Oh, hi there. Welcome back to the Third Space, the nation's favorite health information platform, bringing you health information to your fingertips and everything else in between. My name is Philemon, and today we're going to be talking about a topic that's highly related to the previous episode, which revolved around pregnancy losses and abortions. We're going to link that up here and in the description down below. So today we've enlisted the help of a dear colleague of ours, Vivienne, who will help us unpack the mysteries that surround this particular topic, because knowing me, I'd probably crack an inappropriate joke or two. So please stick around and enjoy the show.
Spaces. My name is Vivienne, and today we'll be delving into a topic that the guys here at Third Space have already burrowed into ever since their first couple of videos. So today we'll be talking about infertility. Motherhood is often at the core of every woman, and childbearing is often revered by women of childbearing age, Aphrodites. This is why it's often a huge shock to many women when they receive the diagnosis of infertility. And couples are met with lots of surprise when they're told that they can't have any children. So infertility often comes with lots of other complications and problems that are often not spoken about. Now, in a study that was done in Ghana in 2017, we can see just a little bit what some of the effects are. 27% of women admitted that they experienced feelings of low self-esteem. 15% of women said that they experienced depression, and a whopping 41% of women said that they experienced domestic violence in their relationship by way of physical and psychological abuse. Now, I'm sure that even you know someone who is battling with this issue, and that's why it's so important for us to talk about it and to educate ourselves. That way, even you can be a better support for couples that are going through infertility. So, let's get into it. Infertility, what is it? Now, infertility is defined as a couple having had unprotected sexual intercourse for a duration of more than 12 months if the woman is less than 35 years old. Now, if that woman is older than 35 years old, it would take 6 months, only trying for 6 months for that couple to be deemed infertile. Now, this definition is very problematic because it brings the assumption that infertility is a woman's problem, but I want to remind you that it's a couple diagnosis. Okay, again, I repeat, infertility is a couple diagnosis. Remember, it takes two to make the baby. Now, infertility can be classified into primary and secondary infertility. In primary infertility, this just means that a couple have been trying to have a baby and they've never fallen pregnant before. In secondary infertility, it's a little bit different because this would mean that the couple tried to have a baby, they have had a child together before in the past, but on trying to attempt again, there are difficulties in conceiving. So that's the major difference. So that means that a couple can become infertile over a duration of time. Now, with these two definitions, there's also a gray area that some couples fall into, and that's called subfertility. Now, this happens when a couple eventually does fall pregnant, but they're unable to maintain their pregnancy to term. Now, some aspects of subfertility were already discussed very well by the guys here at Third Space. If you want to have a look at that and delve into that, just click the video that was done just before this to educate yourself. So, how do we get to this point? It's found that 15% of couples have the diagnosis of infertility. Now, this means that in a room full of 100 people, 15 of those people will have the diagnosis of infertility. I know that doesn't seem like a very significant number, but it is very, very, very significant when you are part of that statistic. Let's talk about some of the causes. Now, contrary to popular belief, we actually have around 3 or 4 main divisions. So we have a third of the factors that are female, we have a third of the factors that are male, and we have a third of the factors, generally a third of the factors, which are female and male combined, and then the remainder are unknown causes. So male factors account specifically for 36% of the weight of infertility. Now, this can generally just be divided into genetic conditions. They may be born with a genetic disorder which avoids them from being able to contribute with the conception of the child. It can be physical problems, which can be from trauma, radiation, heat, any of those issues. And it can also be vascular issues that the male may have within his reproductive tract. And it can also be as a result of lifestyle issues, stress levels, are they smoking, are they drinking alcohol, and let's not forget cancer. Testicular cancer can also be one of the contributors to male infertility. So anything that obstructs sperm production or affects the quality of sperm production or any genetic condition can affect fertility with males. Let's move on to the female factors. So, female factors. Now, ovulatory factors account for 21% of causes why there is infertility in women. Now, this is basically when there is a problem in the way in which the woman produces an egg or releases it from her ovary that impedes fertility. The second cause is tubal factors. What's happening in your fallopian tubes? So if there are strictures, like if it's blocked in any way, if there's an inflammation, or if you don't have fallopian tubes, that will cause infertility, and that accounts for 14% of infertility amongst women. Another issue is also endometriosis, which accounts for 6% of infertility amongst women.
Whoa. Stop yourself right there, Vivienne. You can't just drop something like endometriosis and not explain what it is. Hey guys, Alex here. Now, endometriosis is a process where cells from the inside of your uterus lining or the inner wall end up within your pelvis. If you ever wonder what these are, it's basically the stuff you shed every month during your periods. Now imagine, instead of leaving through your vagina, these cells and blood end up in your pelvis because of your fallopian tubes that are open. This is called the retrograde menstruation theory, which basically states that during menstruation, flow can be so heavy that some of this menstrual product ends up flowing back into your fallopian tubes and into your pelvis. It causes extreme cramps and abdominal pain, and it is very common, but most importantly, it can also be an important cause for infertility. Okay, back to Vivienne.
Coital factors, what happens to the woman emotionally or what happens during sexual intercourse can also account for infertility, and that carries a 6% contribution. Another factor is cervical factors. If there's an obstruction to the entrance to the womb, that can also cause infertility, and that's 6% of the factors. And 28% of factors that contribute to infertility in women, 28% is unexplained. Quick myth buster. So, there is a popular belief that contraceptives cause infertility. What do you guys think? I'll give you time to think. Now, the true answer is that hormonal contraceptives, the short answer really is they don't cause infertility. Because there's a disturbance in the woman's normal hormonal balance, it usually takes time for her to recover after stopping the contraceptives. So within this period of time, a woman is usually in a stage of subfertility. Remember, we discussed that earlier. However, a woman's fertility should get back to normal within a period of around 12 to 6 months, also depending on the type of contraceptive that she has. But infertility is not caused by contraceptives at all. If that does happen, it's very important to seek some medical care from your healthcare provider and so that you investigate what some of the causes are further. So usually the next question is, who seeks medical care for infertility? Remember our definitions way at the beginning of the video where we discussed what infertility is? Just use those. If you are a couple and the female partner is younger than 35 years old and you've been having regular sexual intercourse that is unprotected with no contraceptives for a duration of longer than 12 months, go and see a doctor. But if the female partner is less than 35 years old and you've been trying for more than 6 months, that's also a good time to go and see a doctor. That's just the general consensus amongst doctors. Now, when you go and see your doctor, they'll usually ask you a more detailed history throughout your interview of your sexual history, what lifestyle factors and habits that you have, and also generally what other comorbidities, other diseases that you have that could be contributing to infertility, what those may be as well. And this is just to help us narrow down what some of the causes could be. But I must say, even if you are younger than 35 years old and much younger than that even, please seek medical care if there's a risk of early ovarian failure, that's early menopause, like if a mother or an aunt or first degree relative has a history of that. If there's any malignancies, any operations in your female reproductive tract, and so on, then it's a good idea to seek medical advice very early on throughout your fertility journey. So when you're at the doctor, there will be some special tests that will be carried out. And I'm reminding you, please go together as a couple to the doctor, because the men and women will be tested separately, because remember, there are different factors, male and female, that contribute. So with the men, we test the semen. So we look at the seminal volume, the amount of semen that's produced, whether that's adequate or not. We look at the sperm, whether it's mobile enough, whether it's a healthy shape and morphology, whether the concentration is adequate, and whether the volume or the number of sperm cells are adequate as well. And then for women, what we test is female reproductive hormones round about ovulation. That's when the egg is supposed to be released. We look at the thyroid stimulating hormone. Imbalances in the thyroid can also cause infertility. And then for some women, they may also require ultrasounds to be done. So we look at the uterus. If you have fibroids, we investigate that, and we also look at the ovaries. In some instances, a procedure called the hysterosalpingogram may also be required, and that is basically where we visualize the fallopian tubes by way of injecting a special ink into the uterus. So for the management, as you can see already up to now, there's so much work that goes into investigating, and this is so that we can have an individualized approach to the management, and we're very, very meticulous with our approaches. So before you start with anything, it's very important for you as a couple to make sure that you go through counseling and have the necessary social support that is needed. There are lots of support groups out there in Namibia and on the internet as well. But generally from our side, what we usually start off with general lifestyle modifications. If either one of you is smoking needs to be stopped. Illicit drug use needs to be stopped. Excessive alcohol consumption needs to be stopped. It's very important, especially for the woman, to be within a normal and healthy BMI. So that means that weight control is very, very important. Exercise regularly, reduce the consumption of caffeine as well. And the next one may seem obvious, but it's not that obvious to many. But it's very important for you to discontinue the contraceptives that you are using. Okay?
Yeah.
The frequency of sexual intercourse is also very important. A lot of people believe that if you have sexual intercourse every day, that increases the chances of falling pregnant. Wrong. So that means that you need to wait at least 1 to 2 days, every 1 to 2 days before you have sexual intercourse. So that's round about 2 to 3 times a week that you're having conception-oriented sexual intercourse. And this is just to allow the male partner to produce high-quality sperm. Yeah. So another hot topic for treatment is assisted reproduction technology. So simply put, this is basically when we manipulate the production of egg cells or the release of egg cells and sperm cells or even embryos in a lab in order for there to be a pregnancy. But before you venture into this route, it's important that all reversible causes of pregnancy, of failure of pregnancy, are ruled out. And it's also very important for you and your partner to have a serious talk about the options that are available along with your doctor, options that are available, the costs that you may incur, and also the success and failure rates of any of the methods that you will be using. So outside of these options, there's also sperm donation and egg cell donation, which you can consider, as well as surrogacy, which is also readily available in Namibia. And if all else fails, or if that's also an option, you can also consider adoption. That's always a good option to go by, and it's 100% foolproof and successful. So in conclusion, infertility is very common. It's not the woman's fault, and I hope you learned something new from me today. I'm Vivienne, and this is the Third Space.